Everyone, I'd like to call the meeting to order. The first item on our agenda is the review and approval of the minutes from the March 17th, 2023 Board of Health meeting. Do I have a motion to approve the minutes?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item on the agenda is to review and act on approving and distributing a reminder to the Shrewsbury community of both the plastic bag reduction bylaw and the polystyrene reduction bylaw. Do you have any comment on this, Carrie?
Yes, so DPW thought that it would be good to send a reminder to the community via a mailing, just with just a short blurb from the Board of Health, because both of these bylaws are enforced by the Board of Health. Just to remind businesses and residents that they exist. Since they both rolled out, there's been a huge increase in different types of businesses and certainly a lot more residents, so we just wanted to send it out as a reminder. So DPW has graciously offered to do a mailing, and I will be following up with a news flash with the same information, just to kind of get it out electronically as well.
Okay, great. Thank you, Carrie.
Sure.
Has the board had a chance to review the letter that we're talking about?
Yes.
Okay, so do I have a motion to approve the letter in regard to the plastic reduction bylaw and polystyrene reduction bylaw?
Motion to approve.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. Okay, so the letter is approved, so we can go ahead and send that out.
Thank you very much.
You're welcome. The next item is to review and discuss coronavirus COVID-19 update. So, Solo, do you have a comment?
Yes, good morning, Mr. Chairman and fellow board members. I will ask my colleague, Amelia Halton, Director for the Public Health in the City of Worcester, to give an update, and I'll give an update on the environmental health work in the Alliance community. Thank you.
Thank you.
Amelia?
I was muted. Good morning, everyone. Amelia Houghton. Just a quick update on coronavirus. The monovalent COVID-19 vaccine is no longer available for ordering. And from this point on, if you have not received the monovalent vaccine, you will be receiving the bivalent if you schedule an appointment. And there are rules and guidance to whom should get a or another bivalent vaccine. I can actually send that out to be added to the meeting minutes. It's quite lengthy. Also, in terms of Shrewsbury coronavirus cases, current month, and those are the ones that are reported, and year to date, 262. So it is going down. That's really it for COVID-19 update.
Okay, thank you, Amelia. Dr. Abraham, do you have any further comment, or?
Yes, wastewater surveillance continues to reflect the numbers as was presented. It's about 350 to 395,000 copies per milliliter of wastewater, which is well below the peak levels, which we were running at 2.5, and 3 million copies per milliliter. So definitely been consistently the same numbers week over week, so well below 500,000, so reflecting probably lower trends in the community. What is being watched for is a new variant which originated in India. There's a surge of COVID-19 in India with a new variant of the Omicron called the B.1.116, which is different from the B.1.115, which is the current variant dominant in the US. In Massachusetts, there's about 2.4% cases. The national average is about 7.2%, with states like New York above 9%. And the belief is that in the next 2 to 3 weeks, this will become the dominant variant. Our current vaccines should work against it. There is a minor variation in the spike protein which caused the particular variant. It's interesting that pediatricians from India have reported to the WHO that children who were infected with this, they've seen a predominant manifestation of conjunctivitis, so eye manifestations, which is something novel and new compared to the usual GI illnesses, etc., that we would see with our current variant. So that's not been corroborated elsewhere, but that's been an interesting observation from India, which has had the biggest surge of COVID going on right now. So it's conceivable that we will see a new variant over the summer. I don't think it'll change our practice. CDC has come out with a recommendation for people above the age of 65 and or severely immunocompromised to get an additional bivalent booster for the summer till the fall. And so that recommendation is in place. And other than that, no other major changes. It's anticipated that the masking recommendation for healthcare facilities, et cetera, might go off on May 11th when the pandemic emergency ends. But it will be left to individual institutions or individual hospitals to determine what their masking recommendations will be for their own institution.
Okay, great. Thank you, Dr. Abraham. Any further comments or questions from the board?
Nope.
No? Okay, in that case, let's move on to the next agenda item, which is to review and discuss updates from the Central Mass Regional Public Health Alliance. And I guess, Solo, you're going to comment on this?
That's me, Mr. Chairman, and thank you so much. So, for the month of March 17th to current, in Shrewsbury, there was 9 complaints, 46 inspections, and 13 re-inspections. I believe Carrie did share this document with you all as reference as well. Is there any question?
Dr. Abraham?
Mr. Dennis, I noticed Chipotle is on the list. It has traditionally had, not particularly this location, but Chipotle as a company has had issues with its food processing and multiple violations in different sites, including nationally. It's been cited for that. Was there anything unique about this particular location and why it was cited or complaint was made?
I can follow up with Mr. Mecca, and I can inform the board once he returns. Mecca will be returning Monday, and I can follow up with explanation regarding the inspection.
Great, thank you. Thank you very much.
Welcome.
Okay. Any further comments or questions from the board?
No.
Okay, well, thank you, Solo, for your update.
Welcome, Chairman.
Okay, so the next item is to review our meeting schedule for the month of May.
The May 19th or 26th works.
May 19th?
Yep, that should work.
May 19th, okay? Okay, so let's make it for May 19th at 8 o'clock. Okay, if there's no other, Dr. Abraham.
Just, Mr. Chair, thank you. Ms. Houghton was going to update us about the outbreak of norovirus in the Shrewsbury Nursing Home.
Oh, okay.
Hi, yes, so there has been an outbreak of norovirus in one of the facilities, and they've been working with the state to keep that under control. And we, of course, are standing by if they need anything or any help from us. But the protocols haven't changed, so they have a handle on it, they know what they're doing. And it seems to be a facility where they'll have a few cases, then they catch a break, and then they have a few more cases. So we're actually working with them to see if there is anything we can help them with.
Okay, and what are the possible solutions to this? Is basically encouraging good hygiene, or?
Hygiene, cleaning surfaces, I mean, obviously, it's difficult to control visitors, you know, and outside influences, but they have pretty stringent hygiene protocols currently.
Okay,
So,
okay, great, thank you.
yeah.
Okay, so if there's nothing else from the board, do I have a motion to adjourn the meeting?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is adjourned. Thank you, everyone.
Thank you.
Thank you.
Thank you.